Good morning, wherever you are. This is Riley Knox from ConferenceHype. Our segment will focus on Inca 033989101102, safety and clinical implication. Safety data from the Inca 033989910112 study showed the mutant calreticulin-specific monoclonal antibody was generally well tolerated both as monotherapy and when combined with ruxolitinib in patients with myelofibrosis. Additionally, 89.4% of the 47 evaluable patients across the trial demonstrated a reduction in mutant calreticulin variant allele frequency. This reduction points to possible disease-modifying activity. These findings were reported in the February 2026 supplement of the ASCO post. Looking at the TRANSCEND FL data at 3 years, the overall response rate reached 97%, and the complete response rate was 94% among efficacy evaluable patients. Duration of response stood at 70%, progression-free survival was 68%, and overall survival was 86%. These durable remission numbers highlight the long-term benefit of third-line lisocabtagene maraleucel in follicular lymphoma. The findings were shared at ASH 2025. The inMMagine-1 trial reported an overall response rate of 97% and a complete response rate of 68% with anitocabtagene autoleucel. Progression-free survival reached 79% at 12 months and 66% at 18 months. Overall survival was 95% at 12 months and 90% at 18 months. These data highlight the experimental CAR T-cell therapy's activity in heavily pretreated multiple myeloma patients. A Phase 3 trial is now underway. The Manifest 296-week update showed that adding pelabresib to ruxolitinib produced a spleen volume reduction of 35% or greater in 91.5% of myelofibrosis patients, compared with 57.5% on ruxolitinib alone. Total symptom score improvement of 50% or more was seen in 37% versus 28%. These efficacy findings from the 430-patient trial suggest the combination may offer meaningful clinical benefit over single-agent therapy, as summarized by the ASCO post at ASH 2025.
This is Conference Hype. Stay with us, coverage continues.
In the ReDiact-TT1 trial, the combination of Teclistamab and Teclistamab produced a partial response or better in 79% of the 90 patients, equaling 71 responders. Very good partial response or better was achieved by 70%, while 54% attained a complete response or better. Median duration of response reached 13.8 months, with 64% of responses still ongoing at 1 year. Median progression-free survival was 15.4 months, and the 12-month overall survival rate stood at 74%. Safety data from ReDiact-TT1 showed that 76% of patients experienced grade 3 or 4 adverse events. Neutropenia occurred in 62% of the group. Grade 3 or 4 infections affected 31%, a rate higher than observed with either agent used alone. Cytokine release syndrome developed in 78% of patients, but remained limited to grade 1 or 2 in all cases. 5 treatment-related deaths were reported in the study. In MAGES TEC3, adding Teclistamab to daratumumab reduced the risk of disease progression or death by 83% compared with daratumumab triplet regimens, with a hazard ratio of 0.17. The 36-month progression-free survival rate reached 83.4% in the Teclistamab daratumumab arm versus 29.7% in the control arm. Overall survival at 36 months was 83.3% versus 65%. In the Olympia 3 study of Ardronxtamab plus CHOP for untreated diffuse large B-cell lymphoma, the 160 mg dose achieved an overall response rate of 100% and a complete response rate of 100% among those patients. At the 80 mg dose, the overall response rate was 78% with a complete response rate of 44%. These early efficacy findings were reported from the dose escalation portion, involving 22 treatment-naive individuals.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. The Manifest-2 study, presented at ASH 2025, investigators evaluated pelabresib combined with ruxolitinib against ruxolitinib alone. The randomized trial enrolled 430 patients with myelofibrosis. At the 96-week update, researchers reported multiple measures of disease control, including spleen volume reduction, symptom score changes, bone marrow fibrosis improvement, and progression-free survival events. This combination approach is generating interest as the myelofibrosis treatment landscape continues to evolve according to coverage from the ASCO post. Olympia 3 Part 1A was a dose escalation study evaluating Ardronxtamab combined with CHOP chemotherapy in 22 patients with previously untreated diffuse large B-cell lymphoma. 9 patients received the 80 mg dose, and 13 received 160 mg. The median age was 66 years, and 95% of participants had stage 3 or 4 disease. These first results come from the Phase 3 trial presented at ASH 2025. In the inMMAGINE-1 trial, investigators treated 117 heavily pretreated patients with multiple myeloma who had received a median of 3 prior lines of therapy. These participants received anatarkeptagene autoleucel, an experimental CAR T-cell therapy. The study evaluated how this one-time infusion performed in this difficult-to-treat population now facing limited options after multiple previous treatments. Results from this single-arm study are now informing the next steps in clinical development. The inMMyCAR Phase 1 first-in-human trial is evaluating KLN-1010, an in vivo CAR T-cell therapy for multiple myeloma. The study plans to enroll a total of 20 participants. Data from the first 4 patients show that all had high-risk cytogenetics. 3 received the therapy at a dose of 2 × 10 to the 7th IU per kilogram, while 1 patient was treated at 6 × 10 to the 6th IU per kilogram. This comes from early findings reported at ASH 2025.
This is ConferenceHype. Stay with us, coverage continues.
In the monotherapy arm of the INCA 03398911102 trial, 41.7% of patients reached at least a 25% spleen volume reduction by week 24, while 33.3% achieved a 35% or greater reduction. Symptom improvement was reported by 93.3% of those patients. In the combination arm with ruxolitinib, half the patients attained at least 25% spleen volume reduction and 81.3% experienced symptom improvement. This is from the ASCO post ASH 2025 coverage. The REDIRECT-TT1 study evaluated dual antigen targeting in 90 adults with drug-resistant extramedullary multiple myeloma. Participants had received a median of 4 prior lines of therapy with a range from 1 to 10. They were treated with a combination of Teclistamab at 0.8 milligrams per kilogram plus Teclistamab at 3 milligrams per kilogram, administered every 2 weeks. This approach was specifically aimed at patients whose myeloma had become resistant to previous treatments and involved disease outside the bone marrow. Safety findings from MAGES TEC3 showed that cytokine release syndrome in the Teclistamab daratumumab arm was limited to grade 1 or 2 events that resolved. Treatment-related deaths occurred in 15.9% of patients receiving the combination compared with 33.1% in the comparator arm. These data contribute to the overall profile of the regimen in previously treated multiple myeloma. Researchers used single-cell RNA sequencing along with the COMET platform to compare 14 angioimmunoblastic T-cell lymphoma samples against 3 reactive lymph node samples. This ASH Abstract 555 work from MD Anderson also examined patient-derived xenograft models. The analysis revealed CD40 overexpression appearing across 2 distinct microenvironmental patterns and uncovered a previously unreported T follicular regulatory program phenotype showing FOXP3 co-expression. No prognostic biomarkers currently exist for this lymphoma subtype. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. Additional data from the MANIFEST-2 trial at 96 weeks revealed that pelabresib plus ruxolitinib led to fibrosis improvement in 52.5% of myelofibrosis patients versus 27.5% with ruxolitinib alone. The progression-free survival event rate was also lower at 10.3% compared to 15.7%. These results from the 430-patient study add to growing evidence that the combination may alter disease course, according to the ASCO post-coverage of ASH 2025. In the inMMyCAR study of KLN-1010 for multiple myeloma, all 4 initial patients reached MRD-negative status within 1 month of treatment. By day 15, CAR-positive T-cells accounted for between 22 and 85% of their CD3-positive T-cells. Safety data showed no cases of ICANS, while 3 patients experienced only grade 1 to 2 cytokine release syndrome. These early results are from the first-in-human trial, presented at ASH 2025. Single-center retrospective analysis examined 45 patients with non-Hodgkin lymphoma who received axicabtagene ciloleucel between October 2018 and November 2023. Researchers evaluated how absolute lymphocyte counts at different time points related to patient outcomes after CAR T-cell treatment. The study specifically looked at lymphocyte numbers during leukapheresis and the degree of lymphocyte expansion 10 days following infusion to see if these measures could help predict how patients would fare. The RESTORE trial combined elritercept with ruxolitinib in 38 myelofibrosis patients, roughly 60% of whom were transfusion dependent. Results showed that 45% achieved transfusion independence for at least 12 weeks, 65% had a 50% or greater reduction in transfusions, and 90% experienced symptom reduction. These findings from the ASH 2025 presentation indicate potential for improved anemia management, as reported by the ASCO post. Concludes this ConferenceHype Meeting Watch highlights broadcast on ASH 2025. Which of these findings could change practice? Tag on X and join the discussion. Share this broadcast with a colleague or your clinical team, like the video, and subscribe with notifications turned on for more Meeting Watch coverage.